Welcome back to Fast Mental News. I'm Dr. Bob Brainiac MD. We are here with our guest, Ischemic Stroke. How are you today, Ischemic?
Very well, thank you.
Tell me, how does it feel to kill 160,000 Americans per year?
Well, I don't do all of it. My brother, hemorrhage stroke, contributes about 20% to the death toll.
I see. Now, Ischemic, how exactly do you kill people?
Well, Bob, I come in the form of a brain blood clot. My victims never see it coming. Oh, except when they have a transient ischemic attack, sometimes known as a mini-stroke. This precedes a future stroke. The stroke can happen years after a TIA. Or as soon as a few hours after.
Wow, Ischemic. But what exactly is a stroke?
It is when blood flow to the brain is cut off. If I attack a victim, he gets a clot in his brain. But if my brother, hemorrhage, causes a stroke, the victim's artery ruptures.
Wow, thank you for that insight. But what exactly can people do to prevent you from giving them a stroke?
Well, unfortunately, there are several ways people can prevent stroke. One way is to get your cholesterol checked regularly. If your cholesterol is too high, it builds plaque. Plaque is the perfect blood clotter, which, as I said before, leads to me paying you a visit. My least favorite types of people are the ones that diet to keep their cholesterol down.
I think our audience will take that to heart now. What's another way to prevent stroke?
Another way is to get your blood pressure checked every once in a while. High blood pressure could cause arteries to burst, in which case, hemorrhage would get a client. Also, high blood pressure could cause plaque to dislodge earlier than it would with normal blood pressure. I call that a possible win-win for my brother and I.
Do you have another preventive measure you could share with us?
Well, yes, I know a third one. Avoid greasy and fatty food. It builds plaque like high cholesterol does.
That's good to know. Thank you, Ischemic.
Well, I am always ready to... Darn.
What exactly are the symptoms you cause?
Well, I attack brain functions. So, to name a few: weakness, loss of coordination, and difficulty in reading, writing, swallowing, speaking, and understanding others.
I have to say, it sounds scary to get a stroke.
Thought's my job. To scare people.
Okay. To continue, how can doctors tell that patients have had a stroke?
Doctors will notice the symptoms in the patient, but to confirm a diagnosis of stroke, they will probably give the patient a CT scan to find out where the stroke hit, and whether it was the work of myself or my brother.
We are almost out of time, but tell me, Ischemic, does anybody specialize in stroke treatment?
There are no doctors that only deal with stroke victims, but a brain doctor or a neurologist is a good person to go to.
Fascinating. One last question. How can a stroke be treated?
Once one of us hits a person, they usually don't fully recover. Ever. So the best doctors can do is help treat some of the symptoms. Within 3 hours of a stroke, an effective drug known as TPA can be used to thin blood and prevent further clotting. After that, surgery might be done to extract plaque that caused the stroke. In terms of long-term care, victims usually need much physical and speech therapy.
You have answered so many questions, Ischemic, and I'm sure the audience is enlightened considerably. Thank you, and thank you all. Good night.